My client's name is Alice, who is a 50-year-old Caucasian American woman. Her primary language is English. Alice is married to John and has 3 children with him, Anna, Tom, and Lydia. Alice is currently living in New York City. She has a doctorate and is a logistics professor at Columbia University. Alice is very well educated. The current issues with her mental status is problems with her memory and signs of depression. Alice was referred to herself due to having some concerns over her memory problems at her age. She identifies her problems as trouble remembering annoying things such as words, names, appointments, and stated that she got lost running on the campus she works at. She states that these problems have started affecting her work as a professor. Alice has not had any known head injuries and is currently not on any medication. She reports that she has not had any depression in her past or currently, and is not under any more stress than usual. She reports that her sleeping is normal. Alice's father had Alzheimer's gene, which is familial. Alice notes that her mother and sister died in a car crash when she was 18 years old. Her father also passed and was an alcoholic. Alice saw a neurologist and had an MRI, which showed no problems. She also had a PET scan done, which showed no problems. Alice has been seeing a neurologist since the start of her memory problems and is currently still seeing him. She has no history of hospitalization prior to her diagnosis of early onset Alzheimer's. She did not take any medications. She is now prescribed Aricept and Namdia by her neurologist and is currently taking that. Diagnoses from Alice's initial assessment include a primary diagnosis of Alzheimer's disease and major neurocognitive disorder with symptoms of significant cognitive decline from prior level of performance. The secondary diagnosis, major depressive disorder, moderate. We can rule out frontotemporal degeneration, major neurocognitive disorder. Client will look back at pictures and videos with her husband or children at least 3 times a week for a period of at least 3 months. This will help the client relieve previous memories they may have forgotten and remember the memories she has shared with her family. Client should receive individual, group, and family therapy. Having all 3 types of therapy will help the client to understand her diagnosis as well as relate to others who have the same diagnosis to learn coping skills. Client should receive individual cognitive behavioral therapy, talk therapy, and life story work at least 2 times a week to learn coping skills and address issues with depression and anxiety surrounding her diagnosis. Client should receive group therapy 1 time a month to help relate to others and find additional coping skills. Client should continue taking Aricept and Namdia to help reduce some cognitive and behavioral symptoms. In later stages of the diagnosis, as her cognitive abilities decline, client will need a social worker to help set up possible caregivers or professional help, such as in a nursing home or memory care environment. This will help the client transition from independent living to assisted living with 24/7 care and performing daily tasks. When this time comes, she will continue to meet with the therapist who specializes in Alzheimer's to help her cope with the transition and the challenges she will face. As the client ages, she will need to continue seeing a physician about her health and a psychiatrist for her mental health. Alice is currently keeping up with her treatment plan. She is looking over old photos and videos 3 times a week with her family. She is receiving individual cognitive behavioral therapy, talk therapy, and life story work 2 times a week as planned. She is also going to group therapy 1 time a month. Alice is very engaged in all of her therapy sessions and states they are helping her learn new coping skills. Alice has a hard time remembering some of her sessions due to her diagnosis. When this happens, she makes additional sessions when needed. She plans to continue her therapy into the future.